I'm Dr. Asim Javed. I'm an international cardiologist working at Rawalpindi Institute of Cardiology in Pakistan. This is a series of talks to give an introduction to the techniques in peripheral vascular intervention. So this is an example of femoral artery pseudoaneurysm. You can see over here. And then this is an example where we do the radial punctures and you can see a radial pseudoaneurysm here. So you can diagnose them on ultrasound. And how do you treat them? Well, this is a simple diagram to show you that. So you've got a pseudoaneurysm here, that's the main common femoral artery, and then you've got a neck which connects this artery with pseudoaneurysm. So with ultrasound, you locate the neck, and then with ultrasound compression, you keep this neck compressed, and the blood keeps goes into stasis in the pseudoaneurysm and forms a hematoma and occludes, and the neck gets occluded as well. So the duration of compression is around 10 to 15 minutes. Success rate is 75 to 85%. Complications, very rare, but pseudoaneurysm rupture, distal embolization and venous thrombosis. But you've got to be careful with your compression, and everything is under vision, so usually it does not cause any problems. Same thing shown here. That's a pseudoaneurysm of the common femoral artery, and then you can see flow here. Now with ultrasound compression you can see that the neck is occluded and therefore the stasis is taking place, and then finally it thromboses and the pseudoaneurysm closes. If you want to increase your success further, well, then you can give injection of thrombin directly into the pseudoaneurysm. So what you do is, this is percutaneous procedure, you do the ultrasound guidance, you take thrombin in the syringe and you have to inject under ultrasound guidance into the body of the pseudoaneurysm, making sure you don't inject it into the neck. Otherwise, if this thrombin goes into the common femoral artery, it will occlude that. So with ultrasound guidance, you compress the neck. So now you know that the neck is compressed and there is stasis taking place here. And during that, under the ultrasound guidance, you keep looking at the needle and percutaneously you take the needle into the pseudoaneurysm away from the neck, and then you slowly inject thrombin into it. And so the 100 to 300 units of human thrombin are on average injected. The success rate is around 97% according to several studies. So this is a case which I did in Trauma Center Karachi with an interventional radiologist, Dr. Irfan Lutfi. So here you can see that this is the pack in which thrombin and fibrin come. The red one is the thrombin and the blue one is the fibrin, and they usually come connected to with two bottles connected to each other. So one bottle has saline in it, the other bottle has powder in it, and once you press them hard like this, then the saline enters into the powder. So Dr. Irfan Lutfi only uses thrombin, he does not use fibrin. So here you can see the two bottles are connected to each other, the saline bottle and the thrombin powder, and once they get mixed up, there are two syringes provided in the pack. This is one syringe. So for thrombin, which is red colored, there is a syringe which has red color on it. I'll show you that in a while, the colors. So with the syringe, you now draw this thrombin into this syringe and then you attach this long needle on it. This long needle also comes along with these bottles. So with this needle now, under ultrasound guidance, you can inject. Now this is again to show you the same thing. This is fibrin, which we did not use. Again, it has two bottles. One bottle has fibrin powder in it, the other bottle has saline in it, and then you have to press them hard and the saline will start entering into the thrombin powder, and once it's mixed, you can draw it. Now there's also this kit that comes with it where you can inject the two together. So you assemble this kit, you attach this blue syringe in it, then you attach the red syringe on side by side, and before attaching you have filled thrombin and fibrin in both of them. So one has thrombin, the other one has fibrin, and then now both can be injected simultaneously. So all you do is you attach a long needle at this end, the same needle that we attached there for injecting. Now, now your plunges are back, syringe is filled up, so you inject together, and both of them will go together into the pseudoaneurysm. Um, but thrombin works immediately. I'm not sure why they did not inject fibrin. So here you can see the color coding. One syringe is red for the thrombin, the other syringe is colored blue. This is for fibrin, and this bottle is also colored similarly, red and blue. Here you can see red is thrombin, blue is fibrin, and this is the box which shows everything, how to use it. And this is the supply, how it comes, Beriplast P Combi set 1 ml. So this contains both thrombin and fibrin.
Slow.
Yeah.
Yes, good.
Yeah, after compression it's stagnated ready.
Yeah.
It's almost stopped the flow.
Now compress. Now you can see very
Yeah,
well.
now I can see that needle going in.
Yeah.
Needle was coming in, and yeah, there comes your needle.
Release. You see?
Yeah.
When I जब मैं इन हो जाऊँ ना उसके बाद तुम कंप्रेस कर दो. Compress.
Yes.
Now I'm injecting. Keep compressing. Compress करो.
Now, in the technique, what's important is that the needle should puncture the pseudoaneurysm chamber as superficial and far from the pseudoaneurysm tract, which is the neck, as possible. Under no circumstances should an injection be made directly into the neck, as this will increase the likelihood of thrombosis of the native artery. In patients with more than one chamber, it is preferred to inject into the most superficial chamber first. This usually results in thrombosis of all chambers. However, if flow is still present in the deeper chamber, a second injection may need to be performed. Confirmation of proper needle placement is made with aspiration of arterial blood and small injections of saline to produce a flash of color within the chamber and allow direct visualization of needle tip. Once appropriately placed, the thrombin can then be injected. Inject 0.2 ml aliquots until the pseudoaneurysm and tract are thrombosed or until 1 ml of thrombin is used. This usually occurs within seconds. Less than 1 ml of thrombin is used in virtually all cases, and many pseudoaneurysms can be completely thrombosed with as little as 0.2 to 0.4 ml. Repeat the ultrasound in 24 to 72 hours to confirm continued thrombosis. If the pseudoaneurysm reopens, re-inject on follow-up visit. This can be done on outpatient basis, and patient can be sent home immediately after the injection. I'll now show you two cases that I've taken from internet, but I thought they had good learning value. So let's see those two cases.
This patient's got a left brachial artery pseudoaneurysm arising from his dialysis fistula and a recent attempt at accessing it for dialysis. This was about 4 days ago. The pseudoaneurysm hasn't disappeared, so we decided to treat this with a percutaneous injection of thrombin. Here you can see the prominent neck and the flow into the pseudoaneurysm. There's the neck there with rapid flow through it. And you'll see if we turn the Doppler off in a second that the neck is actually quite small because this is due to the tip of a needle whilst dialysis was being attempted. Obviously, injecting close to the brachial artery, we've got to be careful we don't get any reflux which might cause ischemia of the hand. And here you can see it's quite a large pseudoaneurysm. There's relatively slow flow within the cavity of it when you get a bit more inferiorly. And there you can see it longitudinally. There's the neck. And we'll pass more inferiorly, and you can see the slightly slower flow in the larger cavity. And you can see the neck actually is quite small here, so the risk of distal embolization is very small. So we're going to inject thrombin. This is being made up with 10 mils of saline And this is 2,500 units of thrombin, which is more than enough for most pseudoaneurysms. And once this has been made up, you swirl it. It's important you don't shake it because that can actually denature the protein. And this is made by Baxter, who make a lot of the thrombin that we use, and this is part of it's one of the components of FlowSeal. So we're just drawing up the thrombin component here, we don't need the rest of it. And we're going to inject directly into the pseudoaneurysm with a 22 gauge spinal needle. Very straightforward procedure under ultrasound guidance, and the needle's so fine you rarely need local anaesthetic. And there you can see the needle longitudinally in this instance within the pseudoaneurysm. We're just going to inject the thrombin, just a small amount. You can see immediately you get thrombosis within the pseudoaneurysm, and there's no flow whatsoever. And we'll put some Doppler on in a moment, and you'll see that the aneurysm is completely occluded. And if you look to the deep side of the ultrasound image, you can see that there's still good pulsatile flow in the brachial artery, and the patient had no untoward sequelae from this. We have actually ultrasounded these patients' arteries distally when doing femoral pseudoaneurysms, and we've not seen any distal embolization picked up on ultrasound. So very safe, simple technique, even in the upper limb.
This is regarding a middle-aged lady who had a CABG on IABP, and post-surgery they realized that there is a pseudoaneurysm on the right groin. There's a swelling of the right groin. Patient was referred to us for treatment of the pseudoaneurysm on the right groin. A Doppler was done and subsequently angiography was done. Angiogram demonstrated there is a pseudoaneurysm coming from the right common femoral artery and going laterally and posteriorly, as well as into the two pouches of the pseudoaneurysm, and we can see the flow very nicely. So we decided to go with a balloon-assisted glue injection into the pseudoaneurysm, and we deployed a 8x40 balloon and then checked whether this is sealing it properly, and we are very happy with the sealing. So we now go into the next step and target the pseudoaneurysm. So we targeted the pseudoaneurysm percutaneously with a 24 gauge scalpel set, and we can see nice flow into the pseudoaneurysm percutaneously and going all the way into the common femoral artery, exiting nicely. So we can see the morphology of the pseudoaneurysm. This is what is a target for us for treatment. Here, after injecting 60% glue with Libidol, it has occluded the first pouch, and we can still see there is a filling of the second pouch of this pseudoaneurysm. We are going to target the second pouch as well. So here we see there is nicely targeted second pouch of this pseudoaneurysm. We are going to inject 60% glue into this one as well. So as we see, this balloon is inflated, and our target is right there into the first pouch, and we are going to inject glue nicely over there, and our target is to come back with the glue to the stalk a little bit, so that we can achieve a complete cure of this pseudoaneurysm. Now we can see, yes, the glue has just entered into the pouch nicely. Again, if you just see the injection of the glue, which looks beautiful, and coming back a little into the stalk where we just stopped it. So now we have deflated the balloon and we have taken it out, and the final check angiogram demonstrates there is complete cure of this pseudoaneurysm, and there is no reflux of the glue into the normal vessel. So having the normal vasculature and getting rid of the pseudoaneurysm with the balloon-assisted glue embolization of the right groin pseudoaneurysm following a percutaneous IABP placement.
So covered stents is another option that can be used, or the patient can be sent for surgery.